Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. And ladies, this is a conversation that I know you want to hear about and learn about and what to do about it. And that's a conversation on hormones. This conversation, I'm going to tell you, I sat with it and there's so much to talk about it. And there's so many different stages of a woman's life that we can really, focus on and go all in and really understand what's going on. But because I currently see many women that are going through perimenopause and they are going crazy. Yeah. And if you're one of those ladies, you know what I'm talking about. It just creeped up on you out of nowhere. You're like, what's going on? I was feeling fine. And now I feel like I'm losing my mind, like I'm going crazy. Right? And it's a serious conversation because oftentimes either, spouses or other people who haven't experienced this yet, it's hard for them to understand what really is going on. And they might think you're just crazy. And it's not. There is a true physiological, chemical, hormonal change occurring. And if you don't have the knowledge and understanding of the impact that hormones have on you, it's very difficult for you to understand how real this is. These hormones and neurotransmitters, they have such an impact on how we mentally and emotionally respond to life. Now, it's not to say that that's an excuse to be a bad person, but when there is true hormone imbalance at any age, mind you, at any age, you could be 20 years old and have really, out of balance hormones, and you will not feel well. And so as women, in their 40s start to transition into their 50s, you can experience these early symptoms, what we call perimenopause. So it's like you're not in menopause yet. You're still having a period. If you have, periods, women don't have a uterus, or they're on birth control and they don't regularly or they don't have a period, or they don't regularly have a period because of birth control. But you will still feel the shift. Even if you've had your uterus removed, you can still feel the symptoms of there's a transitioning happening. And so it's not uncommon that I hear this from many of my patients, many of my friends, my social circle, and just online, right, and social media, many people who are women who are struggling with this transition in their life. So what is perimenopause? Perimenopause can happen, in someone's in their 40s, but I have seen women in their mid to late 30s start to have symptoms of perimenopause. And so it is very important. I cannot emphasize, again, to do some, blood work and check your hormones. And we're going to talk in this conversation, we're going to talk about what are the hormones, what are the function of the hormones. I really want you to understand what these hormones are doing in your body and why you feel like you're losing your mind, right? That's what I hear. I feel like I'm losing my mind. There's a lot of crossover in symptoms. These conversations I love to have, and I can get really carried away with details. So I'm going to do my best to keep it in layman terms that you can understand what's going on. So we know, what is a hormone? First of all, what is a hormone? So a hormone, it's a signal that it's signaling something in your body to do certain functions. And we know that there's about 50 or more hormones that scientists have been able to identify in the human body. And like I said, these hormones control and regulate many, many biological processes. Your female sex hormones are not just so that you can have babies. It does so much more than that. It regulates so many other functions, and we will be talking about those today. So like I said, they regulate the physiological and behavior of just multicellular organisms. And so we're gonna focus on talking about what those hormones are and what's going on. So sex hormones is what we're going to be focused on, because like I said, hormones is a broad term. Thyroid is a hormone, insulin is a hormone, but we're going to be looking at the female sex hormones. So I want you to understand that your diet plays a huge role in your hormone production, because the very first thing that the body uses is it uses cholesterol, good cholesterol from your body, to make hormones. And so the very first thing that we see is that the body will take cholesterol and it will convert it to a hormone called pregnenolone. And from here, you have two potential different pathways that your body will make hormones. It can go in the pathway of making progesterone, or it can go in the direction of making DHEA. So from pregnenolone, we make progesterone. This hormone can make aldosterone, which helps regulate blood pressure, and it's made in the kidney. But it also makes cortisol, which is an active hormone, and cortisone, which is inactive. It's kind of like your backup, right? In case you need cortisol, it'll take it from cortisone. And so from cholesterol, we make progesterone, and then we can make cortisol from that. Now, if you have high levels of stress and your body's making a lot of cortisol, it's going to steal from progesterone and pregnenolone. And I'm going to go into detail what these hormones are doing in your body. The other direction that this pathway can go into, from pregnenolone, it can make DHEA. So DHEA has it's made in the adrenal glands, but it has a huge impact on brain health. So does pregnenolone, and so does progesterone. These three hormones have a huge effect on our brain function and our mood and so forth. So from DHEA, our body will first make testosterone. Listen to me. Whether you're a man or woman, it doesn't matter. Your body's going to make from DHEA, it's going to make testosterone, and from testosterone, it's going to make your estrogens. And so the difference between a man and a woman is that genetically, your body knows you're designed to be a male. So you're going to make more testosterone than you will make estrogen. And if you're a woman, it knows genetically you are a female. So you're going to make a little bit of testosterone, because you only need a little bit, and you're going to make more estrogen. But it's all in the same pathway. The amount is going to vary from female to male. And that's just the biology. Sorry, not sorry. That's just the way it works. So these hormones are very important to assess. So what do these hormones do? Like I mentioned, DHEA, pregnenolone, DHEA, and progesterone, aside from sex regulation, reproductive regulation, it has a huge impact on our memory and concentration, and our mood. So it's very important to make sure that we have those. So when we're talking about estrogen, which is very, very prominent in women, right, to have healthy levels of estrogen, there's three forms, but there's two that we only check because they're only present in a non-pregnant female. So estradiol and estrone are two of the hormones that we check. Estradiol is your main hormone. Estrone is a weak estrogen. It's there, but it should not be in elevated levels. So we know that, these estrogens in a female, it plays a crucial role in the developmental and regulation of the female reproductive system. So this includes menstrual cycle, puberty, pregnancy. It develops the secondary sexual characteristics like breasts and hips. But it impacts way much more. It impacts bone health, cardiovascular health, and brain activity in women. So it's very important that we know where your levels are. And when your estrogen levels drop, you start to have joint pain, bone pain. You start to have maybe some high blood pressure issues, some cardiac issues. And of course, your brain function is changing because those estrogen levels went from being normal to being low. And let's be honest, a lot of people just don't routinely check their hormones. So you wouldn't know what your hormones were when you're 30, 35, and now you're 40 and you notice a difference. You don't know if you were over time slowly declining in hormones, which would be, it wouldn't be unusual as we get older. But then it can just kind of creep up on you out of nowhere. Progesterone. Oh, progesterone. It is such a beautiful, beautiful hormone. Ladies, progesterone is what makes you feel calm, cool, and collective. It's what helps you to fall asleep and stay asleep. I know melatonin helps you to fall asleep and stay asleep, but let me tell you, so does progesterone. It has a huge impact on your brain. So this estrogen and progesterone are made in the ovaries, and the functions are a little bit different. Estrogen builds the inner lining of the uterus to prepare it for when an egg is fertilized. It goes and gets implanted into the endometrial layer. And progesterone increases to help the egg be fertilized and, to maintain a pregnancy. But when you're not looking to get pregnant and you're 43 or 45 years old and this declines, you will start to experience anxiety. You will not be able to fall asleep. Of course, with the decline of hormones, you'll have hot flashes. A common sign that I see that a lot of people overlook at is you'll have ringing of the ears. If you're having ringing of the ears along with the other perimenopausal symptoms, chances are that it's because of the low hormones. Once these hormones come up, it tends to regulate and feel better. Testosterone levels are something that, are very important in women still. We make a very small amount, but it is important for us to have enough testosterone because we have, this helps us to have energy, to maintain muscle mass, and sex drive is also impacted by your levels of testosterone. With testosterone, you have the total value, which is like your backup, and you have free testosterone. That's what's circulating, that's what's available. So it's important to take a look at both of those, because if you don't look at your testosterone levels, you may not feel well either. So it's not uncommon when I do labs on 40 and 50-year-old women that their testosterone, as they're going through perimenopause and menopause, their testosterone levels are low. And so that will affect, their quality of life as well. There is so much to talk about this. There's, like I said, these hormones have a lot to do with our cognitive function, our brain health. And so it's not unusual to see women who have decline in their hormones and they feel like they're having a mental breakdown. And sometimes there might be, social issues going on in their family that kind of makes this transition even more difficult. So, what do you do? What do healthy levels of estrogen do for women? Like I said, it protects your heart, your bones, your skin, your hair, brain. All the pelvic floor muscles are because of estrogen. So it's not unusual as, estrogen decreases for women to have something called vaginal atrophy. So the vaginal tissue starts to, just kind of destroy, it becomes less. So there's vaginal dryness, which is very uncomfortable. And that's because your estrogen levels are low. You're going to have mood swings. You can have breast tenderness. If you're having a period, even though your hormones are low, you can have all of a sudden this change in your menstrual cycle and it's heavy. So it's either so here's what I see with perimenopausal women. Maybe they had, regular periods. Now they're irregular. They're having them too frequent, or they're spaced out, or they're really heavy, or they're really light, and they don't feel well during the cycle, during the period, right? During the time that they're flowing, they feel just really miserable. So these could be early signs that you're going through a transition. And, there are things you can do. We're going to talk about that. So when women have low estrogen, those hot flashes are real. It just comes up on them and they feel hot, and it's a very uncomfortable, heat that they experience. In that moment, some women can experience borderline panic attacks, anxiety, panic attacks. They can feel very depressed. Like I said, very fatigued. They can have a lot of headaches, especially like the frontal part of the forehead. They can have a lot of headaches, insomnia, mood swings, of course, infertility. And so decreased libido, so your sex drive is low. A lot of brain fog, difficulty concentrating. Your hair can get thinner. You can have a lot of hair loss, weight gain. So many women will start to gain weight, and it's around their bellies. They'll have a lot of abdominal weight, and nobody likes that. They'll have dry skin, and you can start to see signs and experience pain because of loss of bone tissue, so leading up to osteoporosis. So if you're in your 40s, you're still kind of young to go through menopause. And there are some things that we can do to halt that process. So get serious about your diet, first of all. That's what I tell women. If you're not eating enough protein and healthy fats, you don't have the building blocks. I'm going to tell you something that it's a big pet peeve of mine. And everyone has their opinion, and that's fine. But my opinion and what I see clinically is that women who have a period should not be fasting regularly, and they need to be very careful if they are intermittent fasting, because if you are sacrificing food, remember, food is energy, but also they're the building blocks to make a lot of these hormones. And if you don't have the building blocks to make estrogen and progesterone and testosterone and DHEA and all of the other hormones, right, along with all the other processes in your body, you're not going to be able to make that. Where are you going to make estrogen if you don't have cholesterol? How are you going to make pregnenolone? You can't. So if you're going 16 plus hours without eating, you're hurting yourself, and it's not worth it. So the best thing to do is get a healthy amount of protein, a healthy amount of omega-3s, healthy fats, so that you're getting the building blocks to make these hormones. So the diet is the number one thing. The other thing that I see that really impacts women's hormones is the stress. If you're doing too much, stop. Just stop. Stop trying to be perfect. Stop trying to be the hero in everyone's story. Start taking care of you, because this transition, really should have been talked about when we were very young in our 20s and even as teenagers, because the accumulation of stress that it has on our adrenal glands, it's going to show up in perimenopause. It's going to show up in menopause itself. And so, the adrenal glands, which are on top of our kidneys and they're on the back of our low back, these glands, the adrenal gland, is responsible to kick in and make some of those hormones as we transition through menopause. But if all of your life from youth, you've been constantly under stress, overachieving, overperforming, just overdoing yourself, not sleeping well, not eating well, not taking care of your body, now when your body needs those adrenal glands to make those hormones to, balance you off a little bit, it can't, because your adrenal glands are not properly functioning to pick up some of the work. And so this is why I had a hard time having this conversation on the podcast, because I feel like this conversation needs to start in a really young age in women. Because if young women know to take care of themselves, their transition into perimenopause and menopause is not going to be the same. And I know this to be true because I have spoken with women in their 70s and 80s. And this generation, as they transition to menopause, they don't experience the same symptoms that many women are experiencing now, because maybe their lifestyle was different. There was less stress. There was more moderation and balance in their life. So they weren't, pushing through and blowing through their adrenal gland function in their 20s and 30s. So they're not experiencing a lot of these symptoms to the extreme that I'm seeing right now. I mean, I've had 35 and 38-year-olds that are perimenopausal. And it's because of their lifestyle. It's because they're not eating enough and they're stressing too much. Now, I know what a lot of you say, well, I don't feel stressed. I love doing those things. Yeah, but your body's still experiencing the stress. The other thing is, if you're not sleeping well, if you were not sleeping to begin with, if you weren't taking going to bed at the right time at night. It's an accumulation of over the years that's led up to this point. So now that you're in perimenopause and you can't fall asleep because your hormones are down, what do you do? I'm sure you're like, okay, what do I do now? Tell me what to do, right? Well, get serious about your diet. Start doing a lot of anti-inflammatory foods. Start losing some of the body weight. But more importantly, get into your doctor's office. And I already know they're going to tell you no. Even OBGYNs, they will not do the right test. If you are having a period, you need to make sure you time you do the blood work and time it at the right time to do them, because you want to do them between days 19 and 21 of your menstrual cycle if you do have a menstrual cycle. Now, if you are on birth control and you're like, I don't have a period, I haven't had a period, it's part of the problem. You understand, you've been taking something, a substance has been suppressing, from having a period every month. And now 5 years later, you have not had a period. That's not healthy. And so you might want to consider something else and get off that birth control. But, so that you can see what is your body doing without the birth control on its own. But you want to get some blood work done, get these tests done, get the progesterone checked out, your estrogen and estradiol and estrone, your DHEA, pregnenolone, your cortisol levels in the morning, testosterone total and free. There's another one called sex hormone binding globulin. That lets us know if your body is binding up excess hormone or it's just gone crazy and it's binding hormone that it shouldn't be binding and removing it from the body. So the other two things, I hope young women are watching this. This is really my goal, so they can hear this and prevent from experiencing this when they're in their 40s, is avoid alcohol. Avoid, products that are hormone disruptors like the plastics and chemicals, because that's going to put a burden, a toxic burden on your liver. And your liver's really, a big responsibility of the liver is to metabolize these hormones and convert them. So if your liver is bogged down by toxins, it's not going to be able to do its job. And we know that women who smoke and drink alcohol on a regular basis, they have a higher risk of many, many conditions, especially hormone imbalances. There's a lot here. There's a lot of herbs. I can't really tell you which ones to take, because then I would be treating you. But there are a lot of herbs and natural supplements to help women that are in the transition. And that would be enough. For many, it's enough to help them regulate. Now, we can do, hormone replacement therapies that are safe and effective at boosting up levels of progesterone and estrogen and testosterone. So if you do have a family history of breast cancer or uterine cancer, we always advise that you're cautious with the form of estrogens that you're going to consume. I would prefer that you do a natural source of it instead of doing the hormone replacement therapy. But ladies, if you have symptoms of perimenopause and you're in your 40s or younger, don't wait. Get the help. Find a doctor that's going to help you with that. I offer a free 15-minute phone consultation so I can learn a little bit about what's going on with you. I explain how I work with my patients and, go over what tests we would do. If you have insurance, if you don't have insurance, we can find a way to get the blood work done. Because that's the other negative side of insurance, is that sometimes they don't want to cover the blood work to do these comprehensive hormone panels. But I'll tell you what, there's companies out there that you can do a very comprehensive female sex hormone panel, thyroid panel, some vitamins, some nutrients, and other factors in there for about $200. So don't let money be something that stops you back from taking care of yourself. If your doctor's not willing to do it, find someone who is. Because women are willing to spend $200-$300 to get fake eyelashes. They're willing to spend hundreds of dollars, and if not thousands, on cosmetic things for their face and their body. They'll buy the $200-$300 pair of shoes and purses. Why not take that money and invest it into something that's going to improve your quality of life, that can potentially extend your life, that you're going to feel better, you're going to feel optimal, you're going to feel healthier? Because no one should walk around thinking that they're, losing their mind and they're having psychotic episodes. It's just not okay. But that's how powerful these hormones are. And it is worth to check them out. Hey, look, in my practice, I do hormone testing even in young teenagers. If there is there's signs that's letting me know they're deficient in hormones. Oftentimes the parents are paying cash for those labs because the insurance is not going to cover hormone tests on a 16-year-old, on an 18-year-old, or a 20-year-old, even if they have enough reasons and symptoms to, provide the coding to have them covered. But the investment of doing the test and then looking at the hormones, it is worth it. They start to see that there's imbalances. And so then we can say, hey, this is low and here's that's low. Let's do this. Let's change your diet. In younger people, I don't do hormone replacement therapy. I just don't believe in doing that in young people. What I do is I go through the diet. I go through the lifestyle. I maybe give them some natural herbs and supplements to help the conversion, to help those pathways to make more hormones. And so there's two approaches. There's the natural way, and then there's a hormone replacement therapy. And there's a time and place for those therapies depending on the individual. So if you think your hormone's out of balance, if you're having any of those symptoms, it costs you nothing to go on my website, and I'll provide all that information to schedule a free 15-minute phone consultation on how, we can potentially work together and help you so that, you can potentially postpone menopause a little bit more and not struggle with how you're feeling. So I hope you have, really taken a lot of good information from this episode on hormones and perimenopause. And I see so many women struggling right now with that. And it's not funny. It really is not. It really overtakes your energy and your brain. So reach out. There's solutions. We're going to transition into the good, the bad, and the ugly of our healthcare medical system. So one thing that I have seen in my practice are women who do go to their OBGYN doctors, and they advocate for themselves, which is a good thing, and they ask for hormone tests. And it boggles my mind that even as an OBGYN doctor, maybe they're not trained, to do a thorough assessment of hormones or which hormones and when to do the hormone test. They're just not doing the right test. They might check, estrogen, so estradiol, maybe progesterone, maybe testosterone, but they're not looking at the full pathway of the conversion. So if you're low in pregnenolone, everything else is going to be low. So we know that there's things that we can, supplement to support making more pregnenolone in the body. And also the time of the month that you're doing blood work matters if you have a period. If you still have a menstrual cycle, you need to make sure you're doing those tests between days 19 and 21. So it's not unusual that I have OBGYN doctors that have done the hormone test, some of the hormone tests, a few of them on the patient, but they didn't tell them when to go. So if they started in the, right after they had their period, that information is just not substantial. We can't really use it. In the luteal phase, this is when our hormones are at their best, and that lets us know where progesterone is in relation to estrogen. Ladies, don't suffer and don't struggle in silence. Get some help. It's out there. There's many natural ways to help balance your hormones. Hey, until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.